So today's topic is thyroid disorders, not from the textbook, okay? Just additional classes. In your textbook, there is not a specific chapter for thyroid disorders, okay? But some endocrine disorders have been mentioned here and there in some of the chapters, okay? So here we will discuss about how uh, how diet influences thyroid, or is there any influence of diet and thyroid, okay? So thyroid disorder symptoms depend on whether the thyroid is under or overproducing hormones, because you have hypothyroidism and hyperthyroidism. Okay, we'll discuss these two conditions in detail. Okay, some issues are autoimmune, which means your own body is fighting your thyroid gland. Your own body's immunity, your antibodies and all, they are going and attacking thyroid gland. Okay. So some thyroid issues are autoimmune. It's not triggered by certain diet. It is genetic. It is hereditary. Okay. Treatment for thyroid disorders is often successful, and it depends on the condition. Okay. And treatment can be a combination of either just giving medication, oral pills, or maybe a medication or some surgical removal, or some other therapy, some radiation therapy if it is a thyroid cancer. Okay, then radiation therapy would be required. So it's a combination of different strategies used for treatment. So what does the thyroid gland do? Okay, so it's a butterfly shaped gland located in front of your neck. Okay, and just behind the thyroid gland, this is the behind view of thyroid gland, you have these four yellow dots. If you can see, these are the parathyroid glands. Okay, so thyroid gland and parathyroid glands, they exist together. Okay, they are in front of your neck. So it produces hormone that is controlling your blood pressure. It's regulating your blood pressure, your body temperature, your heart rate, your metabolism. Metabolism, it's the important part here, important role of thyroid gland, and the reaction of your body to other hormones. These all stimulating function comes under thyroid gland. So thyroid hormones. So there is a process in which thyroid gland can secrete hormones. T3 and T4 are the major hormones secreted by thyroid gland. Also calcitonin. Okay, there are three hormones, but in respect to this class, we'll focus more on the endocrine function. So T3 and T4. Okay, these are the triiodothyroxine and tetrahydrothyroxine. Is the two main hormones. Okay, so it starts in your hypothalamus, which is a gland present inside your brain. Okay, just downside of the pituitary gland. Okay, so hypothalamus gland has to secrete TRH. That's a hormone. So hypothalamus will secrete thyrotrophin releasing hormone. Okay, and because of this secretion, thyroid stimulating hormone, TSH hormones, will also be secreted. If TRH is not secreted, TSH will also not be secreted. So TRH has to be secreted, then thyroid stimulating hormone will be secreted, TSH, and from the name itself, you can understand thyroid stimulating hormone will go and stimulate the thyroid gland to produce more thyroid hormones. Okay, until and unless your thyroid gland gets the stimulation from TSH, it cannot produce thyroid hormones. Okay, so thyroid gland requires TSH to produce the major T3 and T4. Okay, and finally T3 and T4 is released into the bloodstream. Okay, how are hormones different from enzymes? Hormones are secreted directly into your bloodstream, not enzymes. Okay, for a fluid to be considered as hormone, it has to be secreted into the bloodstream, and it has to function on some other part of the body. Okay. If thyroid gland is secreting thyroid hormone is not acting on thyroid gland. It has to go out and perform its function on other organs and other cells apart from thyroid gland. That is how it becomes an endocrine organ. Okay. Pituitary gland secretes a lot of hormones. These hormones don't work on pituitary gland. They go out and about, and they go and to their specific destinations to do their functions. Okay, so that is what makes a hormone. It is secreted from one part of the body, but it functions at another part of the body. And how does it go there and function? It's through the blood. Okay, hormones are can travel only through your blood. Okay, is it clear to all how hypothalamus is involved in thyroid hormone secretion? Which all hormones are required for the stimulation of thyroid gland to secrete T3 and T4? So coming to the general functions of thyroid gland, you will see metabolism coming up again and again, and also metabolism of different macronutrients as well. Okay. So first option is your general metabolism. Okay. Increase in metabolic rate and oxygen consumption of most of the tissues. Okay, except your testes, uterus, lymph nodes, and anteropituitary gland. Apart from these areas, remaining every part of your body, every tissue of your body, the way how it will use glucose, the way how the tissues will use oxygen, it depends on the thyroid hormone. Okay, increases the synthesis and activity of many intracellular enzymes. Okay, thyroid hormone also helps the enzymes to work properly. Okay, so that we can utilize energy better. Okay, we can produce heat in our body. Increase the size and number and activity of mitochondria. The more mitochondria you have in your cells, the more will be the metabolism, more will be the energy produced in your cells. Okay. People who have less mitochondria, they are lethargic. Even if they eat food, their cells are not able to produce energy out of that food. So what happens? The body will store that excess energy in the body as fat. It will not be able to burn it. People who have a lot of mitochondria, okay, young children, young adults, okay, naturally they will have more mitochondria in their body. But as you grow old, the number of mitochondria also decreases. Okay. So the more mitochondria you have in your body, you will not gain weight that easily. Okay, because whatever you eat is immediately combusted into energy. Okay, it makes you restless, it makes you energetic. Okay, you will not be lethargic. It also increases the rate of formation of ATP to energize the cell function. ATP is adenosine triphosphate. Adenosine triphosphate. Okay, so what happens is ATP, when it breaks down, triphosphate, it has three phosphate ions. When ATP breaks one phosphate ion, it becomes adenosine diphosphate. From tri to di, from 3 to 2, because one phosphate ion has been broken off. So what happens when a phosphate ion is broken off? Energy is released. Okay. So the more ATP you have in your body, more you will have your energy levels as well. So that is the general metabolic function of thyroid. Now coming to specific, okay, lipid metabolism, fat metabolism. Okay, fat metabolism is increased because now your body, the more mitochondria you have, the more ATP is getting broken down. Your body is in a hunt from where will I get more source of energy. So fat metabolism is high. Okay, it also accelerates the oxidation of fatty acids by cell, which means burning of the fatty acids by cell. More the oxidation, more energy production. Okay. It lowers the cholesterol level phospholipid levels and triglyceride levels in blood. Okay, naturally, it will decrease your risk of cardiovascular diseases. It stimulates the formation of LDL receptors. So that what happens is that LDL, if you have more LDL receptors in your body, low density lipids will go towards that receptor. They will not get stuck in the blood vessels, not knowing where to go, and they will form a plaque there. Okay. So more receptors you have, LDL receptors you have, these receptors will bind towards the onto this low density lipids. Okay. And it will start off a chain reaction to some other functions in the body, but it makes sure that low density lipids are not just hanging around there in the blood circulation, putting you at a risk of developing plaque or atherosclerosis. Okay, so that is how thyroid hormone helps in lipid metabolism. Protein metabolism. Small doses of thyroid hormone increases the rate of formation of proteins by the ribosomes at your DNA level. Okay, some small, not much, small doses of thyroid hormones. Okay, it increases RNA synthesis by genes. So from at a genetic level, you stay healthy. The more RNA is synthesized in your gene, you stay younger. Okay, you have a capability to produce more, to have more cell turnover. Okay, large doses of thyroid hormones can lead to excess catabolism of muscle protein. In small doses of thyroid hormone as required, it is healthy. But if there is too much of thyroid hormone, what will happen? It will break down your own muscle protein. Okay, because thyroid hormone is supposed to break down the proteins so that it can be used by RNA. Okay, but if there is too much of thyroid hormone, your muscle is also made up of protein. This excess thyroid hormone will go and damage the protein there, break down the protein at the muscular level for RNA synthesis. But that is harmful. You're losing your lean muscle. Gastrointestinal function, secretion, it increases the secretion of digestive juices from the pancreas and also the motility. So you will not feel constipated. It increases your appetite and food intake as well. It is necessary, thyroid hormones are necessary for hepatic conversion of carotene to vitamin A. For example, carotene you will get from plants. Carotene is vitamin A, but from plants. If you are having an animal source, a non-vegetarian food, you get the active form of vitamin A as it is. But if you're having plant-based food, if you're having vegetarian diet or a vegan diet, okay, or generally plant-based diet, okay, you get beta carotene. So this is an inactive form of vitamin A. It has to be converted into active form of vitamin A in your intestine, okay, and also in your liver so that it can be stored. Vitamin A can be stored in your body for at least 6 months, okay. So the conversion of this carotene to vitamin A, thyroid hormone is required. And if thyroid hormones are less, it could lead to carotenemia in your body. Carotenemia means too much of carotene in your blood, which cannot be converted into vitamin A. Where will the carotene go? Your body does not have the capacity to store carotene anywhere in the body. So where will this excess carotene be? It will be in your blood circulation, and it will give you that yellow orange tint in your skin color. People who have a lot of carrots, okay, or yellow orange food on a daily basis, they have this golden hue, a yellow hue to their skin tone. It is because of the deposition of carotene. Carotene is that yellow orange pigment in the food. Okay. So carotenemia also, it kind of look like jaundice, but not as bright as jaundice. Okay, you will have a golden hue in your body. Next is at reproductional level. It is essential for normal menstrual cycles in women and as well as for fertility. Women who suffer from thyroid issues, they also suffer from fertility issues, and also to keep up with regular menstrual cycle, it is difficult for them. And in lactating women, it is important for milk secretion. Okay. Women who suffer from hypothyroidism do not have good secretion of milk. Then growth and development, essential for normal growth of soft tissue and skeletal tissue, that is in children or even in adolescents, teenagers. Okay. Those who suffer from thyroid issues, they may suffer from growth retardation, mild growth retardation as well. Okay. It is required for the production and action of growth hormones. Growth hormones are secreted by your pituitary gland. Okay. But for the production and also for growth hormone to function in your body, thyroid hormones are required. Then respiration, it increases the respiration due to increased rate of your cardiac output. Okay. So more oxygen, your body will be in a capacity to supply more oxygen because of increased respiration. And also the way how oxygen disassociates itself from hemoglobin. Okay. That is also increased because hemoglobin, though it carries oxygen ions, but at the right time, oxygen should be able to detach itself from hemoglobin and go into the cells and tissues. In some cases, this detachment doesn't take place. You may have well enough number of hemoglobin, which is well oxygenated as well. But if the tissues are not able to use this oxygen, if your cells are not able to use this oxygen, then what is the point of hemoglobin carrying all this oxygen? So the dissociation of oxygen is important. So thyroid hormones help in this dissociation as well. Is it clear to all? IGF is growth factor, okay? Insulin-like growth factor, or it's like growth hormone growth factor. Dissociation means hemoglobin carries oxygen ion. At the right time, this oxygen ions should leave hemoglobin and go into the cells. That is dissociation. DPG is diphosphoglycate. That's not important for you to understand. Okay, it's found in. It's also the reason how we can understand the blood glucose level, the HbA1c test that we do. Okay. Then at the cardiovascular level, it can cause thyroid hormone. It increases the number and affinity of beta-1 adrenergic receptors in heart. It is just a receptor in heart. No need to by heart the name. Okay. Which can increase the sensitivity to catecholamine. Okay. Because of which the heart can pump properly. Okay. In response to stress, when you are stressed, your heart catecholamines become very important. Okay. When there is high levels of catecholamines in your blood, it gives you headache, sweating, heart palpitations, pain in the chest, etc. Catecholamines example is like dopamine, epinephrine, norepinephrine. These all are the examples of catecholamines. Okay. If you have heard about this name, dopamine and all, these are happy hormones. Okay. Epinephrine, norepinephrine it's your flight and fight hormone, which gives you the strength to get away from a situation. Or when you are stressed, epinephrine, norepinephrine is released. Okay. When you are happy, dopamine is released. Okay. It increases the rate of blood flow towards your skin for heat elimination. So your body temperature is maintained. It increases your cardiac output as well, thyroid hormone. Usually it increases your systolic BP, but it decreases your diastolic BP. What is systolic BP and diastolic BP? When we say what is a normal blood pressure, what is the answer that you have? Usually it is a range. Okay, normal blood pressure should be a range and also based on your activity level. But when I say what do you think, what do you understand by a normal blood pressure? So what is the number that you give usually? Yes, it is 120 by 80 mm of Hg. 120 by 80, not 80 by 120. It is 120 by 80. Okay. So 120 is systolic, 80 is diastolic. 120 is systolic, 80 is diastolic. What does it mean? Your heart contracts and relaxes. That is how it creates that pumping effect. It contracts and relaxes. When the heart is contracting, the blood pressure it generates is 120. Systolic. Okay. When the heart is relaxing, the blood pressure it generates is diastolic, 80. Okay. Because definitely when you press something, the pressure should be high as compared to when you relax. Okay. And even when the heart is relaxed, blood pressure will be there, because understand that your blood vessels are pipes. Okay. And this pipe is filled with water. Definitely water will have some pressure on the pipe surface, right? Similarly, that is what blood pressure is. Your blood vessels are like the pipe. Okay. And blood vessels are always filled with blood. Okay. So this blood which is fluid, exerts some pressure on the blood vessel walls. That is blood pressure. So even if the heart is contracting or relaxing, blood pressure will always be there. So when the heart is contracting, blood pressure will be slightly higher. Okay. Because of that force of pushing out the blood. And when the heart is relaxing, getting filled up with blood, the blood pressure will be lower. That is diastolic. Okay. And it also increases your pulse pressure. If you check your pulse, when you some people, when like if you want to check your pulse on your wrist, just touch the area below your thumb. Okay, where your thumb ends at your palm. Okay, the line of that thumbs when it ends at the palm, just place 3 fingers there. Okay, vertical to the hands. Okay, if you place there, you will find your pulse there. Okay, so when you touch that pulse point and you slightly press it, you will feel a pressure against your fingertips. Okay, and in some people, the pressure that they feel against the fingertips, it is very feeble. Okay, it's very light. And in some people, it is quite high. You can actually feel even without pressing down the pulse point, you can feel the pressure of the arteries hitting your fingertips. Okay, so that is pulse pressure. So thyroid hormones can increase the pulse pressure. Okay. And at nervous system level, it promotes growth and development of brain, especially in the fetal life when the child is growing in the mother's uterus. Okay, during that time, thyroid hormone from the mother will help in the growth and development of the brain of the child. Okay, and it is also essential for normal myelination and development of nervous system in infant. Myelination is a form in which myelin sheath is formed. Okay, that is all too much anatomic part. Just understand it helps in the growth and development of an infant's central nervous system. Okay, for the good growth and development of the neurons in the infant's central nervous system. Increased response of the brain to catecholamines and increases the activation of RAS. The full form of RAS and all you don't have to study. These are big names. But understand, even though your body is secreting dopamine epinephrine, norepinephrine. Okay, these hormones are being secreted, but only if your brain is able to respond to it, you will feel happy. You will know how to deal with the stress. Okay, if your brain cannot respond to dopamine, there is no use of the dopamine being secreted. You will be depressed. Okay, people who are depressed, either their dopamine is not being secreted, or even if they're secreting the dopamines, that the brain receptors are not able to identify dopamine. Okay, so that's how depression can take place. Okay, so the brain also has to respond to dopamine. The brain has to respond to epinephrine, norepinephrine, to feel the situation. Okay, to be in the situation mentally. So that was the functions. So what causes thyroid problems? Problems with thyroid can be caused by either iron deficiency, autoimmune diseases, iodine deficiency, which is common in hilly areas, mountainous areas, autoimmune diseases, which are genetic. Okay, your immune system attacks thyroid glands. And this autoimmune thyroid disease is called Graves' disease or Hashimoto's disease. Okay, then inflammation, thyroiditis, which may or may not cause pain. Okay, it can be painful, it cannot be painful, depends on the subjective cases. Then you may have nodules or non-cancerous lumps, that is thyroid tumors. Tumors may they can become malignant and cause thyroid cancer. Okay, certain treatments like radiation therapy, thyroid surgery, and some medications can also cause thyroid issues. So these are the common thyroid problems. In pregnancy also, there could be thyroid problems. If the pregnancy has begun with thyroid problems, it can get worse. Okay, a pregnant woman before pregnancy, if she was having thyroid issues, this thyroid issue can get worse during pregnancy if it is untreated. And it will cause issues not just in the mother, but also in the child as well. It can lead to abortions, miscarriages, premature birth, low birth weight babies, problems with the child's brain development. Okay, these things can happen. If a woman is pregnant or planning to become pregnant, she has to talk to the doctor about the risk of having thyroid disorder, get it treated, and then she can continue with conceiving. When to check with a doctor? If you have symptoms of overactive thyroid, underactive thyroid, there is a lump or swelling in your neck. Okay, if you have thyroid issues, if you're pregnant and you're having thyroid issues, you have to check with the doctor. Now we will discuss what are the symptoms of thyroidism. Okay, hyperthyroidism and hypothyroidism. So in hypothyroidism, in this blue circle, okay, your thyroid gland is not able to produce enough thyroid hormones. That is hypothyroidism. Okay, so what are the symptoms here? Cold intolerance. Okay, you feel really cold. Decreased sweating, you don't sweat much. Weight gain, constipation, depression, irritability. Periods are irregular. Slow heart rate, low BP, puffy face, muscle or joint pain. Nails are brittle, easily it breaks off. Now coming to hyperthyroidism, when the thyroid gland is overactive, okay, a thyroid gland produces too much of thyroid hormones. Okay, so what happens? There is weight loss or weight gain, depends on the subject. Okay, short and light periods. Periods are there, but for very few days, and the amount of blood loss is also very less. Then increased sweating, nail becomes thicker and flaky, puffy and bulging eyes, heat intolerance, nervousness and anxiety. Heart is beating like when you get stressed. You know how your heart beats fast. Okay, that happens even if the person is not stressed, the heart is beating fast. Muscle weakness, diarrhea. Why muscle weakness? Because too much thyroid hormones will go and break down your muscle protein. catabolism of muscle protein will take place. So that's why you have muscle weakness. Okay. What is the common symptom in both these cases? Fatigue, insomnia, hair loss. Okay. Fatigue means tiredness. Even if they're eating food, they're physically very tired, can't sleep properly, and hair loss. So what are the complications of thyroid problems? In certain complications, the thyroid gland can become larger in size. Okay. It can become enlarged, or what we call it as goiter. Goiter means enlarged thyroid gland, bigger than normal. And physically, what issues it can create if the person is eating something while swallowing and even while breathing, because the thyroid gland, if it keeps on growing, it is going to press on the esophagus, and esophagus will go and press the trachea. Okay, the food pipe and windpipe will get compressed because of the large size of thyroid gland. Okay, so your eating issue, you will face swallowing issues, you will face breathing issues. Graves' disease can cause eye and skin problem. Graves' disease is Hashimoto syndrome, that is autoimmune. An overactive thyroid gland can lead to heart problems like rapid heart rate. Okay, heart keeps on beating, heart palpitations will be there. It will cause irregular heart rhythms, cardiac arrhythmias, or heart failure. Low bone density, because hyperactive thyroid gland can activate parathyroid glands also to be hyperactive. Okay, and if the parathyroid hormones are hyperactive, too much of parathyroid hormones will be secreted in the blood that will take away the calcium from the bones. Okay, that's how the bones become brittle. The bone density will become low. And underactive thyroid gland can cause complications like high cholesterol, high blood pressure, heart problems. That is hypothyroidism, complications in hypothyroidism. Because the metabolism here will become very low. Lipid metabolism, carbohydrate metabolism. Complications of thyroid that require immediate medical attention. You may have to take the person to an ER. Okay. There could be thyroid storm. Okay. It is thyroid storm means, just imagine a huge wave of thyroid hormones were secreted immediately. In a short span of time, thyroid gland secreted a huge amount of thyroid hormones. So what will happen to the person? They will suffer from fever, definitely high heart rate, vomiting. They will go into a state of delirium. Delirium means they don't know where they are, who they are, what is the surrounding environment. They will lose the track of it. Okay. And their eyes will it will look like this in the image. It will protrude outside as if they're gone into a state of shock. Okay. So this is a thyroid storm. Then if the thyroid gland becomes completely underactive, the person will go into a state of myxoedema coma. It is very rare, but it is a life-threatening condition. Okay. And if again hypothyroidism is untreated, it goes into a stage of severe hypothyroidism, and that's where myxoedema coma can happen. Okay, so it could lead to unconsciousness, drowsiness, slow breathing, very low body temperature. Okay, it can go to hypothermia. The person may die of. They can go into a state of coma. Okay, so the symptoms are completely opposite of a thyroid storm. Okay, the face becomes extremely swollen and puffy. Okay, here you can see in thyroid storm, the eyeballs are protruding outside. Here in myxoedema coma, it seems like the eyeballs are going way inside because the orbital region of your eyes, okay, the orbital region of your eyes becomes swollen. So it gives a sense like the eyeballs are going inside. Okay. So in these two conditions, immediate medical attention will be required. That is, the person will have to go to the emergency. So thyroid diseases, it includes hypothyroidism, hyperthyroidism, thyroid nodules, which is tumor or cancer. And you will have to visit an endocrinologist to get treatment for this. The evidence is strongest for adequate but not excessive iodine intake to benefit thyroid health in general. Iodine intake should be normal and adequate. Too much of iodine intake can also cause harm to the thyroid health. Selenium is also an important supplement for optimum thyroid health, especially for people who suffer from Hashimoto or Graves' disease. Selenium supplementation seems to help them. Apart from these iodine and selenium, okay, other dietary changes has no significant relation to hypo and hyperthyroidism. Okay, apart from iodine and selenium, there is nothing else that can improve your thyroid health. Only iodine and selenium is required. T3, T4, or TSH, okay, not TSH, T3 or T4 could be more, that could lead to hyperthyroidism. If TSH is more, it is hypothyroidism, because TSH is trying to stimulate the thyroid hormone, but thyroid gland is not getting activated. So there could be high TSH, but very low T3 and T4. That indicates hypothyroidism. Okay. In hyper, it is the end product, that is T4 or T3 is high. So hypothyroidism, it affects up to 7% of the general population, and women are more affected. Okay, women are more affected. Iodine deficiency is the leading cause of hypothyroidism globally. Levothyroxine as a thyroid hormone replacement, that's a medication. Levothyroxine is a medicine. Okay, that is a hormonal replacement therapy that is given and most commonly prescribed. Okay, many food substances can interfere with levothyroxine absorption, which means if you are taking the thyroid hormone supplement, okay, thyroid, if you're taking medication to correct your hypothyroidism, you have to be very careful about what you eat. So what is said, what generally is advised, that don't take your levothyroxine medication along with your food. Wait for 1 to 2 hours and then take the medicine, because we do not want the food that you eat to interfere with absorption of levothyroxine. Okay. Hypothyroidism, as discussed earlier, these are the signs and symptoms. Hair loss will be there, puffy face will be swollen for puffy face, slow heartbeat, enlarged thyroid gland, dry skin, poor appetite, constipation, periods are irregular, cold sensitivity. Even with a fan running, they will feel really cold. Weight gain, poor memory, cannot tolerate cold. Then hyperthyroidism, it is much more rare as compared to hypo. Hypothyroidism is present in only 1.3% of the general population. Graves' disease is a form of hyperthyroidism that is more common, but that is autoimmune. Okay. Toxic nodular goiter is also a kind of hypothyroidism in which thyroid tumors are formed. Nodular goiter means small tumors, nodes here and there on thyroid glands are formed, which is capable of secreting hormones. That's why you have too much of thyroid hormone. Here, conventional therapies like treatment for hypothyroidism are anti-thyroid medication. Okay, medications that can suppress thyroid secretion. Radioactive iodine treatment can be given. And in some cases, thyroid surgery is required, in which a segment of your thyroid gland will be removed. Because when the thyroid gland, if there are too much of nodes on thyroid gland, thyroid hormones will be secreted from all these nodes, and you don't want that. Okay, so what is the best option? Remove that nodes. remove the thyroid gland, part of the thyroid gland which is affected by cancer. Okay, so automatically the thyroid secretion will come back to normal. Then dietary iodine and selenium are micronutrients that can modify the thyroid titers, thyroid antibody titers. That is a blood test. Okay, just 1 minute. Am I audible? So if you put the patient who is suffering from hyperthyroidism, if the dietary iodine intake and selenium intake are monitored, that can modify certain thyroid antibody titers, which can reduce the thyroid uh, production, thyroid hormone production. So again, the symptoms here, hair loss is found in both the cases, bulging eyes, protruding eyes, frequent sweating, enlarged thyroid gland, enlarged liver, abnormal heart rate, vomiting, diarrhea. Appetite will be high. Okay, hand tremors will be there, and hand sweating. The hands will always be sweating, and the palms will always feel wet. Okay, irregular menstruation. They are very irritable, nervous. Why nervousness? Because the heart is palpitating. Okay, they do not know the stress response. They cannot handle the stress response. They look nervous. Heat intolerance, sleeplessness. Then you have Hashimoto's thyroiditis. Again, it's an autoimmune disease, also called as Graves' disease. It's an inflammation of thyroid gland. Thyroiditis, inflammation of thyroid gland. It can cause goiter. Goiter means enlarged thyroid gland, swelling in the neck due to enlarged thyroid gland and other symptoms. Symptoms are very similar to hyperthyroidism. Too much of sweating, bulging eyes, swollen face. Okay, goiter will be there. That is enlarged thyroid neck area. Tremors of the hands, that is hands will be, it feels like they are shaking with fear. Okay, their hands are always in the form of tremor, and they sweat a lot. You can see here, the armpit area is wet, even their palms are sweaty. Okay, they cannot tolerate heat at all. Okay, they always want a cold environment. And mood changes, they're very irritable, very moody. Changes in the bowel movements, that is sometimes it is constipation, sometimes it is diarrhea. Thyroid gland removal surgery, it's not that the entire thyroid gland is removed. Okay, a part of a segment of the thyroid gland is removed. Okay, and even if it is a thyroid cancer in which we cannot risk, but an entire thyroid gland has to be removed. If the entire thyroid gland is removed, the person will be put on lifelong hormone replacement therapy. Okay, they will have to take hormone pills, thyroid hormone pills, to maintain their metabolism. Thyroid tumors, thyroid nodules, or adenomas. Adenoma means any tumor that happens in a structure that is a gland. Anywhere in the body, if it is a gland like pancreas, thyroid, pituitary gland, hypothalamus, adrenal gland, okay, any gland in your body, if there is tumor in that glandular structure, it is called adenoma. Okay, these are small, non-cancerous growth, but they are capable of functioning as a thyroid tissue, which means they will also secrete thyroid hormone. The adenoma itself will secrete thyroid hormone and cause hyperthyroidism, which means you have your normal thyroid gland, which is secreting hormones. On top of that, you have thyroid nodules, which is also secreting thyroid hormones. So definitely there is too much of thyroid hormones in your system. So you go into a situation of hyperthyroidism. Okay. So thyroid adenoma treatment, it includes surgery to remove any overactive nodule. Okay. Here you will not touch the thyroid gland much. You will only cut off the thyroid nodules. Okay. There will be complications of thyroid surgery, removal of thyroid gland. So complications will be there, but only symptomatic management will be followed through. Thyroid cancer, so it can spread. Okay, this can spread. Thyroid cancer, it is more often it occurs in people who have undergone radiation to head, neck, or chest. If they had brain tumor, or if they had tumor anywhere around their chest or head region, they took radiation therapy for it. Definitely, the radiation will go by the neck as well. Okay, so some cancer, some thyroid tissues may get genetically altered because of radiation, and it can become a cancer. Okay. Uh, However, it may also occur in those without any known risk factors. It can happen to anyone, thyroid cancer. Okay, usually, if you have a family history of thyroid cancer, you will have be on higher risk. And most thyroid cancers can be treated successfully. If it is found early, it can be treated successfully. Symptoms are there is a painless lump in the neck, thyroid gland is enlarged, you have difficulty in swallowing, breathing, and your voice changes because thyroid gland is pressing, the lump is pressing on your sound box, larynx. So there will be hoarseness in the voice. Thyroid disorders in women, it can affect their hormonal balance, cause problems in puberty if it is a young girl, menstruation, fertility, pregnancy, and also in postpartum period. After pregnancy, soon after giving birth, you are in the postpartum period. Okay, postpartum depression also hits women who have thyroid issues. Okay, so what is the medication used here? It is levothyroxine. Okay, that is a synthetic thyroxine medication. T4 hormone is given. It's in the pill form. Okay, that is the thyroid hormone replacement therapy. Even if you have surgically removed the thyroid gland, you will be put on this therapy. Okay, if your thyroid gland is underactive, not secreting enough thyroid gland, you will be put on the thyroxine medication. Levothyroxine is the most common prescribed medication. Then hypothyroidism and pregnancy. Thyroid hormones can pass from mother to fetus, okay, while she's pregnant. And adequate amount of this thyroid hormone is important for normal growth and development of the child. If the mother is not producing enough thyroid hormone, or if she is suffering from hypothyroidism, the child will not get enough thyroid hormones for its growth and brain development. It will affect the child's health as well. Okay. So hypothyroidism in women can be treated during pregnancy. Okay, she will be put on thyroid hormones and medications during her pregnancy. It is completely safe. Okay, but if she is leaving it untreated, it can lead to complications for both mother and child. Okay, for mothers, it could be uh, gestational hypertension or pregnancy-induced hypertension, that is blood pressure, high blood pressure only during pregnancy, eclampsia, diabetes during pregnancy, that gestational diabetes, abruptio placenta. Placenta uh, breaks away, okay, before labor is induced. Postpartum hemorrhage after delivery also, the mother still keeps bleeding a lot. Okay. Fetal complications, it is abortions, miscarriages, premature birth, premature babies, stillbirths, child who is born but not alive. Okay, low birth weight babies, these are common. Postpartum thyroiditis after giving birth, when there is an inflammation of the thyroid gland, okay, uh, that could lead to hypo or hypothyroidism. Depends. Okay, it can go either ways. It is treatable with medication, and about 80% of the cases will resolve within 1 year of treatment. Okay. And symptoms of postpartum thyroiditis: mother will not be able to produce enough milk because thyroid hormones is required for lactation. We have discussed that earlier. So if there is not enough thyroid hormones, milk production will be low. Painless goiter will be there. Hair loss. Hair loss is very common after pregnancy during postpartum period, but this will be accelerated. Fatigue, postpartum depression, anxiety, moodiness. Okay, these are the symptoms of postpartum thyroiditis. Coming to the food part, diet part. Specific dietary influences on thyroid functioning. So these are the main nutrients which you should be, or diet or food you should be aware of. Iodine, goitrogens, cruciferous vegetables, soy, other trace minerals. Okay, we'll discuss each one of them. Iodine first. So functions of iodine: it supports the thyroid health. It supports the overall growth and development because it's healthy thyroid, healthy growth and development. Healthy thyroid, healthy metabolism. Okay, it maintains your energy levels because we have discussed it earlier. Thyroid hormones help maintaining your mitochondria. Okay, giving you enough ATPs for energy. It also regulates your body temperature. So whatever functions thyroid does, it is because of it is getting adequate amount of iodine. Okay, so iodine also performs all this function indirectly. So the production of thyroid hormone within thyroid follicular cell, it requires adequate level of circulating iodine, which is taken through diet. Circulating iodine means blood should have enough amount of iodide. Okay, iodine as it is cannot circulate in the blood. It has to convert into iodide, and in the iodide form, blood can carry iodine. Okay, so circulating iodide should be there in the blood. Only then, as and when it is required, thyroid gland can pick up the iodine and make thyroid hormone from it. Okay, so when you see the term T3 and T4, what is the meaning of it? T3 means triiodothyroxine. T4, tetraiodothyroxine. Okay, so this hormone itself is made up of iodine. So that's why iodine is important for formation of thyroid hormones. Common dietary sources of iodine: main is your table salt, which is iodized. Okay, iodine fortified salt. Then all your seafood, seaweed as well. Seaweed is vegetarian. Okay, and all the other seafood, fishes, prawns, shellfishes, oysters, okay, squids, all form of seafood. Some breads and grains, depends on where you are growing it. If you're growing something near the coastal regions of India, definitely more iodine will be there. Okay, anything grown in the mountainous regions, iodine will not be there, because in mountain regions during the monsoons there is heavy rainfall. There is high chances of soil erosion because of monsoons and rainfalls. What is soil erosion? All the nutrients from the soil will be lost. It will flow down along with rainwater. Okay. Although eating a regular diet should meet the nutritional and iodine needs, some individuals with restricted diets like vegetarians and vegans, they are at higher risk of developing iodine deficiency, thus leading to thyroid issues. Okay. Because vegetables are, even though vegetables have iodine, they are not a rich source of iodine. Okay, they are just an average source of iodine, and the iodine from vegetables cannot be absorbed well in your intestine. Okay, next is goitrogens. Goitrogens means goiter causing nutrients. Okay, so the term goitrogen refers to any substance that can produce goiter. Goiter means enlarged thyroid gland. It is usually accomplished through the effects that decrease thyroidal iodine, which means goitrogens will go and act as a barrier between iodine absorption and thyroid gland. Okay, either in the intestine level or in the blood circulation level. Okay, it will deny the access of iodine for thyroid gland. Okay, any substance that acts as a barrier in iodine absorption or acts as a barrier of iodine utilization by thyroid gland, that is what we call as goitrogen. Okay, it can also inhibit other components of normal thyroid hormone productions as well, not just iodine, but other areas of thyroid hormone production, because iodine is definitely necessary, but there are other things that are necessary as well for thyroid hormone production. So if goitrogen is blocking that necessities also, it is termed as goitrogen. Okay. So most common examples of dietary goitrogens are cruciferous vegetables and soy products. Okay, these are the examples you can see on screen: cabbage, broccoli, cauliflower, kale, turnips, radish, sweet potato, soy products, Brussels sprouts, everything in the cruciferous vegetable. Okay, millets, certain millets, soy kind of millets. Okay, these are goitrogens. Here you will have more examples of goitrogens, cruciferous vegetables: arugula, bok choy, broccoli, different forms of broccoli. Okay, Brussels sprouts, cabbages, cauliflower, Chinese cabbage, lettuce, okay, collard greens, radishes, kale, okay, wasabi is watercress. Watercress is very highly nutritionally abundant leaf, but it is also a goitrogen. You don't have to completely, even if you're suffering from hypothyroidism, be aware of the amount of cruciferous vegetables that you eat. You don't have to completely shut down these cruciferous vegetables. Okay. Weekly, once or twice, if you're having cauliflower, just in one meal. Okay. With a controlled portion of cauliflower. Okay. Once or twice, you're having cabbage, just for one meal. Okay. You have 21 meals that you have in a week on an average basis. Okay. Out of that 21, in 5 meals, if you're having some cruciferous vegetables, it will not cause you any harm. You don't have to be scared of it. You just have to be aware of that. These are the cruciferous vegetables. If you overconsume it, being on hypothyroidism, being on hypothyroidism medication, if you overconsume these vegetables on a daily basis, that can evidently block the way how medications work for you. Okay. So cruciferous vegetables are those of the Brassica genus, that is a species, okay, that include broccoli, cabbage, Brussels sprouts, kale, turnips, cauliflower, collard greens, bok choy. Okay, they are rich in glucosinolates, which have anti-cancerous property, which are good. Okay, glucosinolates are good. It has anti-cancerous properties, but glucosinolates can also inhibit thyroid hormone productions if it is too much in number. Okay. Thus, although eating cruciferous vegetables has a lot of health benefits, okay, but regular consumption of large quantities, that can induce hypothyroidism, or it can exacerbate hypothyroidism. Means you already have mild hypothyroidism. You didn't require any medication, but you started over consuming these vegetables on a daily basis, on a regular basis. Now the mild hyperthyroidism has turned into moderate to severe hypothyroidism. Okay. So you don't have to cut off these vegetables. Be aware and control the portions. Okay. Limit it in your diet. That's it. Limit it in your diet. No need to completely avoid it, because it has a lot of benefits, health benefits, antioxidant properties. Okay. Same goes for soy as well. Soy, we cannot ban it from our food group because it has so much of good health benefits, cardiovascular health benefits. Okay. but it is sadly a goitrogen as well. Okay, so soy products like soy milk, tofu, soy sauce, tempeh, miso. Okay, they all have isoflavonoids. They are really good antioxidants. Okay, but isoflavonoids can inhibit your thyroid action. It's an enzyme, thyroid peroxidase. It's an enzyme which is required for thyroid hormone production. Okay, so it inhibits the function of this enzyme, thus inhibits the production of thyroid hormone. And it has been proposed, not confirmed. It has just been proposed that dietary soy can intake may increase your risk of hypothyroidism in euthyroid individuals. Euthyroid individuals means a person who has normal functioning thyroid. They don't have any issues with thyroid. That is euthyroid individuals. Okay. If you don't have any thyroid issues, you are a euthyroid individual. Okay. So if you consume a lot of soy product, it can increase the risk of hypothyroidism. And euthyroid individuals who are living in iodine replete areas, consumption of soy properly or has no adverse effects on serum thyroid functions, which means uh, coastal areas. Okay, if you are a healthy individual who does not have thyroid issues and you live in a area where which is not an iodine depleted area, it's the iodine replete areas like coastal part of India. Okay, if you are consuming soy, it will not have any adverse effect on your serum thyroid function. Okay, please mute yourself. Somebody who was unmuted. So if you have enough intake of iodine, you don't have to worry about soy. Why not just avoid soy? Because we have strong data, immense amount of studies done on soy, which has proven that soy can reduce the risk of autoimmune diseases, breast cancer, mortality from breast cancer, prostate cancer, hip fracture, cardiovascular diseases. So the benefits of soy is much higher than just one disadvantage is that it is a goitrogen. Okay, the benefits of soy surpasses the disadvantages of soy. So we cannot just simply avoid soy from the food. Just make sure you are having enough iodine rich food and consume soy along with it. You will not have any issues with soy. Okay, then you have selenium. So selenium is a micronutrient that is important for thyroid hormone metabolism. The richest dietary sources of selenium is seafood, especially oysters. Yeah, oysters are the best source of selenium and organ meats as well. Typical sources of selenium in diet: grains, meat, poultry, fish, eggs. And some studies have shown that the benefit from soy supplementation in individuals who have autoimmune thyroid diseases like Hashimoto's and Graves' disease. Okay, there has been benefit to them when they started taking the selenium supplements. And low selenium levels, people who have low levels of selenium in their body, they have a higher risk of developing goiter. Okay, especially in European women, goiter or thyroid nodules in European women, because the study was done in European women. Okay, the sample size was limited to European women. So a worldwide study was not done yet. Selenium-rich foods, eggs, oat bran, Brazil nuts, beef liver, sardines, that is mackerels, grass-fed beef, sunflower seeds, chicken, brown rice, tuna. Okay, how the amount of selenium that you have per 100 gram is also given. Other trace elements that are helpful in thyroid health. Okay, zinc, copper, magnesium is important in thyroid hormone synthesis. and also in general metabolism as well. Meta-analysis of age studies. Meta-analysis means studies, researchers that had large group of people. Okay, sample size was quite high. That is meta-analysis of age studies have suggested that there is a relationship between levels of selenium, copper, magnesium with thyroid cancer. So people who have lower levels of selenium, copper, and magnesium in their blood serum, okay, they have a risk of developing thyroid cancer. But the given available scientific evidence suggests that supplementation of these minerals just for promoting your thyroid function is not healthy. Okay, which means if you start taking selenium, copper, and magnesium just to prevent thyroid cancer or just to maintain the thyroid health is not feasible. Okay, it definitely supports the health of thyroid cancer, but the supports the thyroid health. But taking these minerals just to avoid thyroid cancer is not prescribed. Okay. Other dietary considerations for thyroid. Coffee decreases the absorption of oral levothyroxine. So don't take the levothyroxine medicine along with coffee. Coffee, tea, alcohol, okay, they also have the same effect. Gluten-free diets, sugar-free diets, probiotics, okay, are advocated for promoting thyroid health. Myths about thyroid diet and your thyroid health. First, you can't eat cruciferous vegetables if you have thyroid disorder. Not true. You can have. Limit it. Okay. Be aware of your portion controls. Be conscious about how much you are eating, how often you are eating cruciferous vegetables. Okay. That is important. You don't have to completely take them off your diet. You should take iodine supplements if you have an underactive thyroid. Not true, because if you have an underactive thyroid, medication will be given to you. Some dietary changes you have to do, that's it. Gluten-free diet can help with Hashimoto thyroiditis. It's not true because Hashimoto disease is an autoimmune disease. Okay, a gluten-free diet cannot help with that unless you have celiac disease. Gluten-free diet is only for celiac disease, not for anyone else. Then weight gain from hypothyroidism. If you have hypothyroidism, definitely your metabolism is slow. It's slow. Okay. But doesn't mean that if you have gained 10 kg of weight, you can't blame it on hypothyroidism. Maximum weight gain will be around 3 kg. Okay. Maximum 3 kg will be the weight gain because of hypothyroidism. Anything more than that, it's because of your lifestyle and your diet. Okay. You can't blame hypothyroidism or thyroid issues for your excessive weight gain. Then people with thyroid disorders need to be on special diet. Not true. They can have their regular diet. They just have to avoid daily consumption of cruciferous vegetables. Weekly, once or twice is fine. Okay. So concluding today's session, apart from the definite role of iodine and selenium deficiency, there is no other dietary factors that can improve your thyroid health. Only iodine and selenium can. Okay. There is a gap that has to be filled with studies. Much of the facts are still unknown about thyroid disease. These areas has to be studied more by modern medicine, and more research is required to be done. Okay, but so far only iodine and selenium has been shown to improve the thyroid health, nothing else. Thank you. That's all for today. If you have any queries, please mention in the chat.